Welcome, everyone. Glad to be back at Hartford Hospital, which has hosted a number of our public health initiatives in the past and is at the forefront of really providing great care and education to people so that we can prevent and prepare for diseases that can be reduced in severity and frequency, and that's why we're here today. The flu season is here. 1 death, 22 hospitalizations already. The flu has been active in Connecticut since the end of August, which is typical of a flu season. Our hope is that people will prepare for it so we can prevent death and costs more effectively than last year. There were 154 deaths in Connecticut last year from the flu, 80,000 across the country. That is an intolerable impact, and it is completely preventable if people simply get their flu shots. Getting a flu shot is important not only to you, but to the people around you, because if you get the flu, you become a contagion agent. You are endangering people around you, particularly if they're over 65 or if they are young children. And the death already this year is someone over 65, showing how perilously vulnerable our seniors are to the flu. They are the ones at great risk. They should be getting their flu shots right now. If you're over 65, there's no reason, no excuse to delay. Now is the time. It is the flu season right now. It may still feel like fall, but flu has been active since the end of August, and already 22 people have been hospitalized for the flu. Many more will be by the end of spring. And just to put it in dollar terms, the costs nationwide of care are over $10 billion, and the impact economically over $87 billion, which leads to the second point I want to make. Any flu shot is better than none, but some flu vaccines can be more effective than others. We need a vaccine that is most effective, and that requires a universal flu vaccine. That's the effort that I am helping to lead in the United States Congress by devoting research money, $1 billion over the next 5 years, to developing a universal flu vaccine. Right now, flu vaccines are effective anywhere between 30 and 60% of the time. Last year it was about 36%. Still better than nothing. Saves a lot of lives and a lot of dollars. But we need a universal flu vaccine, and that's why the Flu Vaccine Act has attracted strong support in the Congress. We have about $100 million in the budget for fiscal year 2019, but it should be increased to $200 million a year so that we spend $1 billion over the next 5 years and really achieve a universal flu vaccine. So again, I'm proud to be here in Hartford Hospital. 1 death, 22 hospitalizations. No reason for panic, but yes, concern. Legitimate worry about the flu because it can be a killer. And certainly it is extremely costly and it can be prevented so easily. I've had my flu shot. No reason, no excuse for you to avoid yours, because it can save lives and save dollars. So with that, let me turn to Dr. Ross,
Thank you.
Who is the real expert.
One thing I would stress today is we are early in the flu season. As I mentioned before this started, we saw our first inpatient last year on this day, the 22nd of October of 2017. We saw twice as many people last year as we normally see. We had over 910 cases at Hartford. I can't stress enough the importance of the elderly getting vaccinated, and get vaccinated now. In an average year, we'll have 5 deaths. Last year, we had 21. And 85%, or 5 out of 6 of them, were over the age of 70. For others, about Election Day is a great time to make sure you've had your flu shot. You can tie the two together. Why is that important? Because in your homes, in churches, when grandparents come to visit, when you go out to social functions, you'd like to have people less vulnerable vaccinated so you can get what we call herd immunity, protect the others. For those of you who may be my age or younger, flu shots don't work as well as we go up in years. It may be incredibly effective at young ages and college kids. Get the college kids vaccinated. Get the kids in high school vaccinated. Once you get up around 65, the effectiveness of the shot decreases rapidly. So ideally, vaccinate the young. If you vaccinate the young and those who are middle-aged, you will protect others. In the flu season last year, 85% of the cases we saw admitted to Hartford Hospital were over the age of 30. So it shows you, again, just the breakdown. Go after the young folks.
Thank you. Would you like to say something?
No.
Okay.
And he's here. This is our amazing Dr. Fernandez, who's here to speak Spanish, if anybody needs a Spanish translation. We also, certainly we have lots of time for questions, but we've set up a mobile flu clinic over here so that you can get video of folks who are getting their flu shots. Right.
And if you have any, before you move over there, if there are any questions, happy to answer them. Or for Dr. Ross.
Dr. Ross.
Yes, sir.
The victim of the 65 or 65 plus year, what region of the state? I see the breakdown by county.
I don't know where they came from, actually. I can tell you it was not at Hartford Hospital.
Male, female?
I don't know.
This is the Department of Public Health reported it. And I can give you it's on their website, but it does not seem to have that information.
And
Doesn't
Dr.
seem to
Ross,
have a
so last year we did see a lot of the patients who were 65 and older suffer the most in the flu season. Is there any indication that this flu season could mimic the one that we saw last year in severity based on what you're seeing so far?
It's a great question that we're asked often. We really don't know until the season develops. For us, we generally have a pretty good idea what the flu season is going to look like. After Thanksgiving, right around the time of Christmas, we know that last year for us, we had a 7-week peak beginning in early January, and it just didn't stop. Our season ended at this hospital about the 14th of May last year. It was a long season, one of the longest I've ever seen. It actually started early in the season, too. As I said, our first inpatient admission last year was on October 22nd. So again,
This year?
we have had one case here, inpatient, one outpatient. I know of 2 other cases in Hartford Healthcare. That's all right now. But this is not unusual. We always start to see cases early September, October. Where we really see it take off, though, is when the kids come home from college for Thanksgiving. And then we see it take off again when they come home from college for Christmas and the spring breaks, the winter break then.
Can you talk a little bit about the symptoms of the flu and how it goes from being a typical case to the flu to something more serious? What is that like?
Most of us will get the flu, and for those of you who've really had the flu, you feel like you've been hit by a truck. It hits you suddenly. You don't want to get out of bed. You'll take to your bed and stay there. You will be tired for 10 to 14 days after. But that's not all the cases. In the healthcare field, we worry because 15 to 20% of the time, you can have just mild symptoms. What you're referring to is what we see, and what leads to death often is the body overreacts. You get what's called a cytokine storm. It just means your body sees an intruder. It says, I need to react to this. But in the process of reacting and excreting chemicals and white cells reacting, it causes damage. And then you end up in intensive care, or as we talked about last year, I think at one of these conferences, ECMO.
When does, maybe, if I can ask a question, the contagion period, when can someone infect another person? When does that begin and end?
The question is, how long do we worry about transmission or isolation, particularly in a healthcare setting? Generally, it's 7 days or 24 hours after the last symptoms, except cough. What many people do not realize, the cough can last 16 to 20 days after you have influenza. But in a hospital setting, Senator, we will isolate somebody for 7 days unless they're discharged prior to that.
So this is important, you know, for, as you said, for the college students or relatives coming home. Oh, well, I had the flu. I got over it 7 days ago, so I'm coming home for Thanksgiving. And relatives are over 65. They are at risk. People should be aware that as much as you want folks to come visit, people over 65, as you said, are particularly vulnerable, even if they have the flu shot.
And actually in young children and also pregnant women. I get many calls about what should I do. I have my family coming over for Thanksgiving, for New Year's, for Christmas, and what we'll tell them is put a mask, try to stay separate from the person as much as you can, particularly for pregnant women because they are at increased risk of severe flu.
Is it alarming to see a death by this time of year? Or
it is and it isn't. It's the first reported death. Our season varies anywhere from October, November, December, where we'll see the first death, just like with admissions.
Okay.
You know, I want to emphasize we're not here to sort of raise undue alarm. Death is serious and alarming no matter when it occurs. Unfortunately, a death by this time is not atypical for a flu season, nor are hospitalizations. But they should be a cause for alarm because people should be worried. They should be concerned. I'm concerned. That's the reason I got a flu shot. I don't want to be out of work at the United States Senate, although I sometimes wish I were not there. You know, the ordinary people ought to get their flu shots, and I just want to, as somebody who is over 65, if I may comment, yes, it may be less effective for people over 65, but it is still worth doing, even if it's just 20% effective, even if it's 30% effective. It's costless to you. It's covered by insurance. It takes a minute or less, and it can save you a lot of pain and suffering, not to mention costs and potentially infecting other people.